Cool. Hello everyone, thanks for joining us today. So my name is Iris and I'm the founder of Solely Original. So for those of you who are new, Solely Original is a revolutionizing female footwear brand that allow you to design your own shoes on our 3D website. And also with an option to have your shoes made to measure using our remote fitting technology. And so your final shoes will be beautiful but also comfortable that you can walk in. So for today's live chat, we've invited Marion, who is a award-winning podiatrist based in London Harley Street, and welcome.
Hello, thank you for inviting me. I think your idea is fantastic, and I know a lot of people will be very interested in using them. I'll definitely be one of those people, and I'm not paid to say this, right? I'm not paid to say
Oh, it's very kind of you saying that.
I genuinely thought that when you contacted me, it was such a fantastic idea that I wanted to kind of like, be a part of it, and I think it's really, really fantastic.
Okay, thank you for your kind words. And so, first of all, how did you get into, to be a podiatrist and when all these amazing sort of media coverage? I think that you have been featured on The Sun, Mirror, and some other sort of amazing sort of press. And so we are very fascinated to hear about your story.
So I have been a podiatrist for 12 years, graduated in 2008. I don't even know what year it is now. And I did actually nursing first. So I went to King's, which is where the nursing school of Nightingale, Florence Nightingale, who is a very famous nurse. Obviously, she's not alive now because it was in long time ago. And then after nursing, I wanted to become a physiotherapist, and I was scrolling through the website of physiotherapists, and I came along this podiatry website, and I was like, oh, that's very interesting. And at that time, I was trying to be a very, very smart individual. I did not want to study the entire body. I actually wanted to study one section. I thought, oh, that'd be a lot easier. So, so I applied, I got in, and I was like, this is the best thing ever. When I went to my first clinical placement, I was like, oh, wow, this is really, really interesting. So the thing about podiatry is that you can do surgery, you can cut things out, semi-compressed belt, you can make shoes if you wanted to, you can do a lot of advanced technological things, and that's what I've come into kind of fungal nail infections using lasers and scanning feet with biomechanics scanners and things like that. So my practice is quite advanced, and it's just a wonderful job, and I recommend it for everybody. No bias or anything like that, but if you have the opportunity to study some type of medicine, go into podiatry, because the population is getting older and everybody needs their feet to walk and to go out and things like that. And if you have painful feet and nobody's treating it, then you won't be able to go out, and it affects psychosocials and everything like that. So podiatry is a very, very important medical profession. So I recommend, if you are young and you don't know what you're doing, go into podiatry.
Oh wow, that's amazing. Especially I guess to lots of ladies, feet are something that they want to hide, and especially if there's even small kind of problems and they feel kind of embarrassed about it. And we've also had instances kind of in a pop-up shop, and we have this amazing sort of foot scanner there, and then they even feel shy from taking their feet out to do a scan when they didn't have a pedicure done. And so have you seen any of your clients like that and feel quite, I don't know, embarrassed about some of these problems, and what would be your advice in terms of ladies like these?
So both men and women come in with feet that they're a little bit embarrassed about. And obviously, I understand why. Sometimes they haven't shown their feet to their partners, or they've been married and their husband hasn't seen their feet, or they're just really embarrassed about taking their shoes off at somebody's house or wearing flip-flops in the summer. And I think the best thing is, if you have any kind of foot issues that you're embarrassed about, is really to see a podiatrist, or even have a nice pedicure. Because a pedicure, they can do wonderful things. They can superficially cut your nails, they can paint it, hide things, and then they can do a basic kind of pedicure where they take off the skin. And sometimes after that, it's a really kind of brilliant effect, where it's like before and after, it's like, oh, this is quite nice and clean. And with nail polish, you can really cover any ugly nails and things like that. But if you've got really painful feet, or really, really embarrassed long-term issues like a fungal nail infection, or like really severe cracks heels, or really thick dead skin, then really you should see a podiatrist, because the infection can spread and it can make you very sick. The hard skin can build up and it can be very, very painful. And this is not just in older population. You can get it when you're young, you can get it in your working age. So taking care of your feet is the best way of almost preventing any embarrassing moments, because you're taking good care of it, and then hopefully you have the confidence to show off your feet. So definitely have a pedicure, or you can do some home care, scrubbing it with a foot file, putting cream on your feet. That really, really helps. Or see a podiatrist. That
Yeah,
will help.
I mean, like, it sounds like, you know, a lot of people like that. It's like a chicken egg situation, isn't it? Like, the more you embarrass about the problem, the longer you delay from getting the treatment, the worse it gets, and then the more embarrassed that you kind of feel like. And so, we would really encourage all the ladies out there, if you do feel like, you know, there's any problem at all, small or big, then like don't delay seeing podiatrists like Marion, and she's amazing. Right, and so you know, we think you know, all feet are beautiful, and I think it's a part of the nature in our ladies, and we always kind of pick out flaws. Even if like you have amazing sort of body and hair, there's always something that like you can pick out that's not perfect. And so I think like it's very important that we can all sort of like work on ourselves to kind of get over that insecurity, I'd say. Like, and you know, once you kind of show off that confidence, that would automatically translate into your perception to other people, then you would seem much more beautiful. Yeah, so moving on to the next question. And so how did you secure all that amazing sort of press coverage?
I have no clue. I don't have an agent, so if anybody wants to be my agent, I'm free. I'm very, very lucky, I think. I think you need to be open to opportunities. And I've always have myself open for many, many opportunities. Even if I need to go into work, like on a Sunday or a Saturday, when we're really not open, if somebody emails me, gives me a call, and they say, do you want to do this? I always say yes. And then obviously, once somebody knows that you're willing to do things like go on TV, go on radio, submit your videos online, then they keep on coming and coming and coming. And then sometimes it's a little bit of luck. Obviously, there's loads of podiatrists, amazing amazing medical profession, but sometimes it's just very, very, you know, I'm a very, very lucky person, to be honest, throughout my whole career. And I just don't know. It just happened one thing over the other, and then I got invited on The Doctor, which is an Emmy award-winning show. I've been on ITV, and I have a documentary coming out with me and Dr. Kenny, which everybody, if you're on YouTube, knows about Dr. Kenny, because I always make fun of him, and he does a bit of treatment. So we have a documentary coming out on Bark, or now it's called Truly, about me treating a couple of patients, and it's really funny. When is that? I'll tell you. But it's just take every opportunity that you have, and good things will come to you.
Yeah. Oh wow, that's amazing. Would you mind sharing us a little bit more about your ITV was that interview and what was it like?
So the ITD thing was kind of good help save money. It spent the whole day. We were late actually. We were late to getting there. If you take the tube, it's actually quite quick. But we took the taxi and we were late. And we filmed about a couple of hours about products that are equivalent to expensive food products and how you could save money. And then, so that was me just talking about kind of products and things like that. The Emmy Award winning show was about an ingrown toenail video that I posted up online, and the people thought it was really gross, but I thought that was just standard, it's not really gross. And then I got to talk about that, and I was on another TV show for Channel 5 Star where I just pull people's nails out. This person was really embarrassed about her feet, and then I was just pulling her nails, and she kind of vomited. It wasn't my fault. She's just sensitive.
Oh my god.
Yeah, many opportunities, many opportunities. And like I said, then it was the documentary in regards to Miss Foot Fixer. So that's my YouTube name, Miss Foot Fixer, and it's like I said, a documentary about that. I think it's coming out in a couple of weeks' time.
Yeah, oh, we look forward to it. Yeah. Okay, so shall we go into a little bit more about the question specifically about foot? So, from your experience dealing with foot conditions, is there like a percentage of like the foot problems that you've seen that people develop are like sort of genetically versus, I guess, problems developed by wearing bad shoes?
Mm-hmm. So there's obviously the genetic component of things that you can acquire, and then obviously there's mechanical force from a bad pair of shoes. So genetically, you can get bunions, you can get an extra toe if you wanted to, like just a little tiny sixth toe. And you can also be genetically predisposed to fungal nail infections or even like deformed large toenails. In regards to kind of footwear, so in the olden days in China, or maybe even Japan, they would squeeze women's because they wanted really tiny feet. Tiny feet means you get to marry a good man, and
That was
obviously,
a,
hopefully, they don't do it nowadays.
yeah,
I
that
don't know
was the
anything.
standard of beauty, wasn't it? It's like,
Yeah, standard beauty.
like as if you're slim and you're
Mhm.
small petite, and that's
Yeah, exactly like that. And so obviously there's a correlation between tight, small shoes to the shape of your feet. So when you buy shoes, it depends on what type of person you are and if you're female or male, because we might have some male people watching right now. But if you don't want to have any deformities like bunions, claw toes, heel pain, um, the main thing is to make sure that your toe box is not too narrow. So like, not sharp like that. Because if you imagine this is my foot and it squeezes like that long term, you can see all my toes are quite clumped up together, and that's not really healthy. You want to make sure that maybe your toe box is square for men. I know men are into nowadays these really pointed shoes, but it's not that great if you have a bunion or if your family history of bunion, is that can actually exacerbate it. If you're a businesswoman working in the city, you're probably wearing some nice high heels. High heels can give you a lot of confidence, which is great. So, and it looks really nice. It shows the calf muscles and everything like that. But what the heels can do if it's too high is that it can kind of shrink the calf muscles, and then your foot is at an upward angle. And then when you try to wear flat shoes, it's really like ballet pumps and things like that. It's really hard to put that heel down, and then you get tendonitis and kind of muscle pain in the calf muscles. And then in a podiatry world, so in podiatry world, we like square shoes, really thick sole because it provides cushioning. The upper needs to be has fastening and all that kind of stuff. In the business world, it's probably the ugliest shoes you could ever wear. But you kind of want fastening so the foot doesn't move up and down. Okay, if you imagine you were wearing flip flops or if you were wearing kind of ballet pumps, you really need to grip the front of the shoe to hold the shoe in place. And if you're gripping, then your toes can claw, and then that can lead to secondary clawing of the toes and things like that. So it's very difficult, because in a podiatry world, we want the best for the patient, but it's probably the ugliest pair of shoes. But I think the main thing about footwear is that you're comfortable. Okay, if it hurts, don't wear them. If it's comfortable, even if you love wearing high heels and it's comfortable, then just wear it. But obviously, we start seeing deformities, clawing, bunions, and nail issues and things like that, and then stop wearing them.
Oh wow. Yeah, I mean, like the fashion industry is always have this saying like beauty is pain, but to what extent then like this pain becomes so severe then it's no longer beautiful.
And I've been there. I when I met my husband like 10 years ago, I was wearing heels everywhere. I even wore heels to a zoo. And then one day he said, you don't need to wear heels. You're walking really slow. So I started wearing trainers, and now I've got big feet, but it's I can feel comfortable. But I just don't know how I wore heels back then. I just can't really imagine. But I guess, yes, I think I lived through it. Maybe I was thinking paracetamol, you know, maybe I was so in love, I ignored the pain. But I agree, yeah. It's
yeah. But from your professional kind of side of your brain as a podiatrist, did that ever come across your mind, like wearing high heels or like sort of bad fitted shoes kind of would cause your long-term sort of I don't know, damage in terms of health-wise?
I think with all medical profession, you don't listen to the advice that you give. I don't know if I'm wrong, but I'd rather look good.
That's a bad example to our audience. Don't listen.
I'm not the best person, but I always recommend, if you come to my clinic, you know that I'll be talking about like really ugly, like kind of like I just recommend trainers all the time, and just really ugly shoes. Like, yeah, wear that. But like, I work in business. It's okay. That's why. But yes, I don't really listen to my own advice. And I guess I was aware, but I was young and naive. But now I'm aware, and I don't have any bunions. I don't have any cold toes. I don't have any callus. I don't have any corns. I do have a little bit of dry skin in the heel, but who doesn't? Right? I'm using cream. But yes, my feet are, I think they're pretty perfect for the number of feet I've seen in my lifetime. They're top.
It could be a bit of a biased samples. Right, okay. Moving on to the next question. By the way, if you're listening out there, if you do have any questions at all throughout the session, do feel free to send in your questions and we'll come to it later. Okay, so the next questions we have for you is, are flats definitely better than high heels kind of as a footwear option?
Again, it depends on your foot type. If you're used to wearing high heels and then you try to wear a flat, it's not going to be very, very comfortable. Flats are easy to put on, but flat shoes like ballet pumps or Tods, sometimes they don't have a lot of cushioning, so the sole's not thick, so the impact from the foot to the ground is quite close, and that can cause a lot of foot pains and things like that. So I think you wear whatever shoes that is most comfortable for you. If you've got lots of fat on the foot, then fine, you can wear a bit of ballet pumps or Tods and slip-on flat shoes. But you always want to have a little, in that podiatry world, okay, we're talking about a little bit of arch support, a little bit of heel, and obviously enough room at the toe box to accommodate your toes, so you can spread your toes, and also have good kind of movement, because when you walk, the big toe has a lot of kind of function. It pushes you forward, so that's why it's so important for the toe box to have enough room to accommodate that movement too.
Yeah, and so when you say like a little bit of a heel, what's the sort of ideal heel height that you would suggest?
Kind of like not this, like an inch, not. Yeah, it's not too much, to be honest.
Right.
Obviously, like heels, I see some people like that. That's just too much because it will tilt your foot forward, and then what happens is your forefoot, this area here, will build up a lot of callus and corns and things like that. So kind of like the, like you're a little bit thicker than the picture that you have there. I see.
Oh, right.
A little
Okay.
bit thicker. Yeah.
Yeah. Okay. So, not like those. You see some sort of loafers that they have no heel at all, and they could be bad if the sole is too thin. Maybe like so for the one in our picture that's more like a sort of 1.5 inch. Yeah.
Yeah. So like I said, like if you've got, it depends on the type of feet. I can't say like I can't say like, oh, if you wear the shoes, your foot's gonna like turn into like perfect shape. I always say whatever is comfortable for you is really, really important. So if you feel like you can wear those nice pointy, because some toes are like some feet are like that, like pointy, they probably could wear the shoes that you're in your background, and it's got a nice heel. But like I said, what podiatry or podiatrist recommends is maybe not ideal for kind of your population who is into fashion, unfortunately.
Yeah.
But what you could do is, for example, the pair of shoes that you have there, you can put some gel inserts inside. You can even customize a pair of orthotics that will give you a bit more support and cushioning.
Yeah.
So there are things that you can do for the shoes itself, and obviously you can customize it in
Yeah,
solely,
absolutely. Yeah,
have a bit
so
more cushion and things like that.
yeah, exactly. I guess like for some ladies that they just prefer to have pointed toes. And so for that, when we kind of make the shoes to fit them, then we can still take into account their foot measurements and sort of balance, to some extent, the width and the toes to make it more sort of bearable than those ones kind of off the shelf shoes. And so yeah, okay, thank you. And so when you said when the sole is too thin, then you could have kind of heel pains or foot pain. What sort of pain is that specifically?
So you can get the foot's quite big. You can get like foot pain. So if the shoes are not the right size, your toes can claw. So you can start developing corn and calluses, rubbing against the nail and the toes. Okay, and that can lead to pain. Corns are quite painful. You need to actually take them out, and if you don't change your shoes, they come back. Forefoot area, you can get Morton's neuroma, which is like kind of swelling of the nerve, and you can get metatarsalgia, which is just pain here. You can get fat pad depletion, because then your bones are prominent, and then obviously if you're walking without cushioning in the shoes, so thicker sole is better, so it's got cushioning, and that can cause inflammation around this area. If your shoes are too flat and you've got a high arch foot like that, and you're trying to push it down with a flat pair of shoes, it doesn't really take. It's like a bridge, and it's adding pressure onto the bridge, and that can lead to pain in the arch area, plantar fasciitis. If you are heavy heeled and you're not wearing shoes that are has thick sole, then what will happen is you can get plantar fasciitis, you can get heel spurs, you can get just calcaneus pain around, heel pain in that area, Achilles tendonitis. So there's so many things that
Could
can
go
happen.
wrong. Oh.
Yeah, in the foot itself. So you just have to be really, really really careful. But like I said, some people can just wear heels every single day without cushioning, and they're fine. But I always recommend, like, if you're wearing heels, have some gel cushions and things like that. It really, really will increase your comfort, and then obviously you can wear a longer period.
Yeah. You don't need gels or cushions in our shoes, because we use memory foam, and it's like really, really thick, a bit like what we call it foot doobie in our shoes. Yes. Yeah. Okay, and so I was going to ask you. Yeah. So when you say comfort, it's a lot to do with somebody's pain tolerance, isn't it? Like, and so even say somebody felt like, oh, they can put up with the pain, they're relatively comfortable wearing a pair of shoes, they could still develop problems, right?
Of course. Age genetics. If you can tolerate the pain, well, if there's a little bit of pain, that means something must be going on. But yes, you don't, if you're genetically predisposed to the foot problem, then obviously you're not going to get potentially pain, because you can have bunions and you're wearing the perfect shoes. You can have perfect foot. You can have you can have a perfect shoe, but you can still develop bunions. So which might not be painful. So it doesn't mean that it would definitely, by wearing narrow shoes and all of that, it doesn't necessarily mean that you'll have bunions and cold toes and hammer toes and corn and calluses and things like that, but it might increase the risk of it. So it's not definite.
Yeah, okay. Good, that's very useful advice, thank you. So the next question we have is, what are the most important features that you look for in a pair of shoes? I know that you have mentioned into the square toes for shape, and then sort of support in general, but like, can you just kind of share a bit more details about the kind of look of the shoes?
So toe box, width, depth, length. So ideally you want to have so let's say this is my longest toe. You want to have half a thumb. Some people say a thumb to half a thumb width. Okay. I like, myself personally, some arch support, because I feel like if I don't wear arch support, my foot feels a bit collapsed, to be honest. Maybe because when I was pregnant I gained a lot of weight, but really helps. And I personally like some kind of fastening, just to hold my foot in place. But I think the most important thing is the arch support for me, and the toe box area. In terms of material, it depends on what season and things like that. Obviously leather looks nice, but it might not be breathable, and if you have kind of infections and things like that, it might actually harbor more infections. You could wear trainers, but sometimes trainers, they're breathable but they're not waterproof. So today it rained in London, and obviously the water can get in. So it really depends on what you're doing, where you're going. You know, I wear trainers actually, and I change my trainers every 6 weeks, because I treat quite a lot of fungal infections and things like that. So but I don't buy very expensive shoes because I chuck them away. Probably not great for the environment.
Wow.
But I don't want to pick up an infection, because obviously things can drop into the footwear and then cause infection, things like that.
Right, okay. If, say, obviously, advice for ladies who don't work in a podiatrist clinic, how long would you suggest people to kind of change shoes? Would it be literally as long as the shoes last, or is there such thing for like sort of footwear hygiene that because they're quite old that you should just be disposing them for new pairs?
If you have a cystic infection, itchy feet or anything like that, they need to go. Okay, there's no point of keeping them, especially if you don't wear socks. So there was this paper, I think from the United States, that showed that bacteria can last, if you hide your flip-flops and then you take them out and they swabbed it and there was still bacteria. So actually bacteria and fungal infection can last very long in shoes. Imagine if you never change your underwear.
You know? Wow.
Not very nice, is it? So I think be sensible. I know some people have really fancy shoes. I know your shoes are quite expensive, right? Like 100 and something pounds. So you might not want to get rid of it. There are ways to disinfect them. Let's say we don't get rid of them, okay? But ideally, if you wear them all the time without socks, probably get rid of them after the summer or whatever. But there are things that you can do to disinfect your shoes. So you might not need to get rid of them if you really don't want to. So spray, antifungal spray, antifungal powder, wearing bamboo socks might stop any kind of, well, not stop, prevent a bit of transfer from the foot to the shoes, and changing the interior sole. So going to a shoemaker and change my sole. But there's also things that have a UV light. So obviously, UV light kills off loads of germs. There's loads of devices out there, Amazon it, Google it, stick it in, turn it on for anything from 8 minutes to 45 minutes. The reason why there's such a big time frames because bacteria takes 8 minutes to clear, but fungus takes up to an hour to clear. And remember, these devices or sprays or powders don't get rid of 100% of infections, okay, or smell, whatever is lurking around. Only gets rid of around 90% of it. So you can still have the chance to accumulate. So if you don't want to throw them away, do what I just said. But if you do want to throw them away, I don't know. It depends. It really depends. I can't answer that because it really, like, if you work in a sewage place, then you probably want to change your shoes like every day. But if you're a woman working in business and you've got like 10 pairs of shoes, then you don't really need to throw them away because you're only wearing them once like a week. But if you wear them shoes every single day, like ballet pumps, I have loads of patients who comes in with ballet pumps, then I would say change them every season, like every summer, or when they start to smell or they don't look right.
Yeah.
Like
I mean,
dying.
shoes can be quite personal when you feel like they're comfortable, and then they're the kind of designs that you wear to most of your occasions, and you can be quite attached to them, and throwing them away is quite a challenge.
And we see that in like young population, old population. In the National Health Service, we'll see people that say, oh, they're like really old grannies, and they're like, no, shoes are so comfortable. But there's like, you can see that the toes are like bulging on the toe box. So the toe box is the front of the shoe. Like you can see like really lumpy, but and they're really attached because they're so used to wearing that pair of shoes. And you tell them every time you see them, you need to change your shoes, and they'll be like, and they come back in with the same shoes. So sometimes it's true. Some people are attached, and all the business women and men out there, if you're making money, you're buying some really expensive shoes, and I don't know how many times I had to have this conversation with my patients about changing their shoes, but they're like, oh, my shoes are really expensive. And I'm like, really sorry. And then that's when I say you can disinfect them. But when you're having treatment with me, you can't wear them because I don't want to be responsible. But once I discharge you, you can do whatever you want with them.
Right, okay, that's very interesting. Okay, next question. So you've mentioned bunion a few times, obviously, and we have seen quite a lot of that as well, like from our own customer base. So can you just share a bit more of like the cause of bunions and if you have any suggestions for the method how to kind of prevent or cure it?
Of course. So bunion genetics. So if your mother has it, grandmother has it, then you can have it. Your father has it, you can have it. You can acquire. So accidents. So if it deviates, if you knocked it, then it deviates. A tightness of the muscles, the lateral muscles, or fallen arches, that can contribute to a bunion itself. Rubbing of the footwear. So bunions have different grades of bunions, but sometimes you can get the bone enlarged, not the deviation of the hallux of the big toe is the hallux. I want to show you my feet, but they're not that pretty right now because there's still some paint. It's weird. Let's not talk about it. But anyways, so there's deviation, but sometimes you can just like get that bone growth, and sometimes it can be shoe wear rubbing against it, and then the bone gets really, really, really big, and then you get that bunion itself. And then obviously, so tight shoes can lead to it. I think there's some research on that online. What other thing? I think that's about it. So how to fix a bunion? If it's mild, you can potentially save it. So if it's like a little bit of deviation, you can use braces to obviously, it's like a muscle or bone. You can always manipulate it. If it's deviated, you can have it straighter. Okay. You can massage kind of the arch area. You can strengthen the arch area. That can make the hallux kind of a bit stronger, and that stops the deviation. You can get an elastic band, tie it around your big toes, and then you do some stretches. There are things called yoga toes where you put it on like that, and then it straightens up the toes. The braces are like splints that can also hold the bunion straight, but you have to use them long term. You can't just use it for one day and go, hey, my bunion's straight. you need to use like any body part that you're trying to train. It takes many months, and I think the main issue is compliance. If you have a very bad bunion, then you can have surgical intervention, which is depending on what bunion you have, shave the bone or actually break the bone and then fuse it. I don't do that. If you need recommendations, I'm sure I'll find you somebody. So you can try to prevent it by originally wear, if you're not predisposed to it, you can originally wear good shoes to prevent it. But if you see that it's starting, you can do all the following things I mentioned before. Or if it's bad, then you refer to surgery. So usually when it's bad, is let's say you're in pain a lot, then I would refer you, or you really don't like the cosmetic look. And some men, they don't care about the look. So they just live with it. So it depends on how much it's affecting you. And some people think bunions are beautiful. So you might want to keep your bunions, but obviously if it's causing pain, discomfort, then do seek help.
Okay, we've not seen many of those think it's beautiful, but I think that goes back to the confidence thing. Like, it's brilliant if you think, every part of your body is beautiful, and then that in itself is a beauty, right? Right, and so you've mentioned arch a few times as well. So I think maybe to some of our audience that they new with arch, can you just explain a little bit of what's an arch and what sort of issues can go wrong with your arch?
So the arch is, the foot's quite long, and the arch is the middle part of the foot. And there are many different types of arch. If you have a flat foot, then you have no arch. If you have a neutral foot, or like a normal foot, then you have a little tiny arch. But if you have a kind of high, kind of quarter-toed and high arch foot, then your arch is really kind of like that. And let me sit on the side here. So if you have flat foot, then you're a bit more prone to kind of bunions. And obviously your foot's so flat that when you walk, it just hits the ground, and then you can get arch pains and things like that. If you have a normal arch and you're wearing the right shoes, usually there isn't really any major problems itself. But if you have high arch, what will happen is you can see my toes or my fingers are already clawing, and then when you wear shoes that are not deep enough, it can rub against the shoe and then cause kind of lumps and bumps, ulcers. Again, the top here, if it's not the correct kind of like upper, then it can irritate here. So the arch is very important. It also helps you adapt onto the floor. So if your arch is, so in gait, your arch goes through many different phases, and so to push you forward, to step forward, your arch needs to be not just kind of like arched. But once your foot is on the ground, actually the arch needs to collapse to adapt onto the floor. So the arch is actually a very important component of walking and standing and adapting and everything like that.
Yeah. Okay, that's interesting. So if you are interested and have like sort of arch related queries, we do actually have options for our arch shoes to be made with arch support built in, so you don't have to put extra things inside your shoe, which could completely mess up the fit of the shoes. And so based on the measurements, then it depends on how high or low that your arch is, and so we actually raise up the shoes in the arch area to just give you a little bit more support as you walk.
Excellent.
Okay, so the next questions we have here is, do you have any suggestions to we've answered this question already. Are there any problems that you see people tend to overlook but they shouldn't have?
Overlooked, but they shouldn't have overlooked.
Yeah.
People things that they overlook that they shouldn't overlook. Do you have an example? I'm just thinking of what shouldn't overlook. By the time they see me, they're already looking at it. So I'm just thinking of what things that they shouldn't.
For example, I guess like blisters and pains, and people felt like it's normal day-to-day that process when they break into a pair of shoes, and some of these kind of day-to-day problems could go horribly wrong if they don't look after it like you know.
Yeah. So obviously blisters are a very common thing, like you said, when you wear new shoes, and majority of people don't have any issues. But obviously, if you have a blister, if it's not infected, don't burst it, and then you can get some kind of blister plasters to protect that area, because when you want to break in your shoes. But if the blister opens and you ignore it, that can become infected, and that can lead to lots of secondary problems. I would say, when you get a little bit dead skin in the little pinky toe, again, if you leave that sometimes and you wear tight shoes, that can actually lead to corns and ulcers and things like that. So maybe if you feel like you have a bit of callus on your toe, just file it down a little bit, not too much, just so that the hard skin can reduce.
Do you mean like the hard skin from like old blisters and
You can have hard skin from old blisters, but they usually, by the time it dries, it would come off anyways. But like things like corns, but it doesn't develop. So things like corns doesn't develop over time. It usually happens with like on the top of the toe, sometimes on the bottom, but usually you get a little bit of hard skin. And then over time, as you leave it, it builds up, and then it leads to a corn because it's compact of keratin. So I would say if you have a bit of hard skin or dead skin, try to file that down to prevent it turning into a corn, because a corn, you definitely need to see a podiatrist. You could use corn plasters, but they're dangerous. I've seen many infections with corn plasters. I would say maybe nail problems, ingrown toenails. If you feel like your shoes are too tight and they're not fitted properly, and you feel like, ooh, that nail is not right. I think I have a lot of patients who's gone out and then they've worn a really tight pair of shoes, and maybe they're a bit drunk too, and then the next day they find that their nails are bruised, and then they leave it, and then next couple of months the nail turns green, becomes infected, or becomes fungus. So I would say try to maybe treat those things earlier rather than later, because obviously it can over time lead to quite a lot of complications and things like that.
Yeah, what does a bruised nail look like? Is it just a bit of like sort of blood stain underneath?
Yeah, so depends on what stage it is. So if it's early stage, then it's like bright red, sometimes bluey color. Then the later stage is like kind of a darker red, and then the late stage is like dark purple red.
Right.
And what will happen is the nail will grow out. As the nail grows out, the blood stain will also push upwards too, and that's when you know you have trauma. Unlike an infection, like a fungal infection, it usually stays or moves down. But the color is very, very important when you have a bruised toenail.
Wow. And so it doesn't just grow out itself, and then the infection could potentially stay inside.
So sometimes if you have a bruised nail, and let's say the nail doesn't grow, and then you keep on knocking it, then you can actually, fluid can trap underneath, and that can lead to an infection and quite a lot of pain. So one of my friends who ran at the London Marathon had that, and that's on my YouTube actually. I popped it. She tried to like live with it, and then it didn't really go away, so I had to pop it, and the liquid came out. And I think I prevented an infection. And then obviously, because the nail is when you knock it, the nail is a weak structure, and if there's an opening between the nail plate and the nail bed, then obviously bacteria can get in, and that can lead to infections, fungal infections, potentially bacterial infections, and things like that too.
Right. Okay. Was it an accident from that person who ran a marathon? But presumably it wasn't caused by bad footwear. Supposedly they're all wearing kind of trainers to run a marathon.
So I think what happens is when you run a marathon, your foot swells, and you never really train yourself in that pair of shoes for 20 something miles. To be honest, you do what, couple of miles here, a couple of miles there, and then obviously running for 4 or 5 hours, maybe as the foot expanded, it led to a bit of obviously not enough space, and then that led to trauma, and obviously repetitive micro trauma to the nail plate, because the toe is going like that while you're running, and then that could lead to kind of call it subfungal hematoma, or blood underneath the nail. Sometimes it's also swelling and blood in the nail bed too, so not just the nail plate, because soft tissue underneath can get irritated and inflamed and bloody too.
Wow, that's very interesting. I didn't know that wearing trainers could have such problems as well. Yeah, wow, okay. We really do need to take care of our feet.
Yeah, very important.
Yeah, indeed. So the next question is, do you have any tips on daily sort of foot care?
Daily foot care. So always cut your nails, but not too short. Don't cut around the corners. Also depends on your kind of toe shape. And let me just do something. I think my phone is running. I'm on my phone. I'm going to charge this because there we go. Got some battery there. Cream. So cream your feet. Cream your feet very, very often, twice a day. And a urea-based cream is really, really good because it takes off some of the dead skin and then it really rehydrates the foot itself. Use a foot file, use a pumice stone to remove all the dead skin, and that will keep it nice and soft. Foot care. Use nail kind of rehydration, kind of ointments, oils, and things like that to keep the nails healthy. Don't wear nail polish for a long period of time because sometimes it can stain the nail, make it pink. Sometimes if you use really like bright colors like red, it can stain the kind of leave white marks in the nails, and that's never very good. And then what else can you do? Wear the right shoes. I think that's about it. Creaming your feet, cutting your nails, filing your foot down. Yeah, I think that's, I'm wearing good shoes. I think that's about it.
Mhm.
Yeah. Have
And then-
pedicures every so often. Yeah.
And then in terms of like nail varnish, like sort of what's long is too long. Just give us kind of like an idea.
I would say summer is okay. When it's winter time, you should really let them breathe.
Right.
Show them to the world because they're not supposed to be covered. They're kind of the nail plate dead. But if you cover them for too long, that's when you can't see the nail, and then when you do pick up an infection, you can't see it, and then what happens is you take away nail polish and you're like, oh my goodness, what is going on? So I would say if you have infected nails, to take it off when you're not in an event or on a holiday, just kind of leave them out. And then winter times, you don't need nail polish. Nobody sees your feet anyways.
True that. So a few months is good. Yeah. Okay. Next question. Could footwear choice affect the health? Oh, you answered this question already. I was going to ask affect the health of our nails, and of course you said not being too narrow. But since somebody asked this question, just would be great if you can re-emphasize that again.
Of course. So obviously, if they're like, so if they're not the right size, it can hold the toes, but it can bang onto the nails.
Mm-hmm.
And sorry, so there's a baby here. What are you doing? No, I'm having an interview. Anyways, it's like my husband is going crazy. Sorry about that. So there's other things that can happen to the nails. If the shoes are too tight, or you do sports, the nail can get damaged. That can lead to infection, but the nail can be thickened too, which is what we call onychoxic nail. So if you imagine your nail is this flat and then it gets really thickened, then it adds a lot of pressure onto the nail bed and it's really painful. You can also interfere with the nail matrix if your shoes are not the right, and then you have lines on the nails, which obviously weakens the nail structure, and then that can lead to secondary infections and pain and things like that. If your shoes are too narrow, especially there's a correlation between bunions and narrow shoes and ingrown toenails. So all of that increases the risk of ingrown toenails. So if it's not the right size, again, you can have ingrown toenails, and that's when the nail digs in and causes lots of complications sometimes and lots of pain. So when I see my patients, I sometimes when I think, oh, your shoes look too small for your foot. So I actually measure the foot, and I use just like a scale. And there's a ruler. I use many different devices because when I was doing my PhD, I was measuring the risk of nail deformity and toe deformity to footwear size. So my prediction was that if you wear really tight shoes, or you're not wearing the right size shoes to the foot size, that will increase your risk of nail damage, like on your coccyx and stuff like that. So yeah, footwear is really, really important to prevent kind of trauma, prevent thickening of the nail potentially. Obviously, if you were born with thickened nails, it's not going to prevent it. But if you wear the right shoes, it could prevent a lot of complications in the nails too.
Yeah. Okay, that's very useful. Thank you. We did mention about the choice of sort of footwear in terms of like sort of footwear shapes, and especially toe box. And I think from our previous week session, and if you do need further advice on this, and like we would recommend you to kind of watch that back. And yeah, so next question. Do you see any correlation between age and foot conditions?
So it depends on what foot condition, but almost maybe children are less likely to have nail problems, bunions, and things like that. So I would say the older you are, you're more prone to kind of dry skin and hard skin, because your sweat gland doesn't release it. It's not working as efficient, and your skin becomes thinner, so you get more dry skin. Also, bunions and claw toes, ulcers, infections as you get older, because you have other underlying problems like diabetes, rheumatoid arthritis, and things like that. In the kind of like 20s to 30s, 40s, 50s, nail problems, a little bit of biomechanics. Obviously, they're more active, right? So they probably have like calf muscles, heel pain, ingrown toenails, and things. But there is, as you get older, you can have more complicated foot problems that don't mend as well. And if you're older and your immunity is not that great, then maybe you can't have bunion surgery. Then you have to live with a bunion, which can, obviously, if you're not wearing the right shoes, then that can ulcerate, and then it becomes quite complicated. So I guess, yeah, there is a little correlation between worsening of the foot as you get older if you don't take care of it, and you don't take care of your underlying kind of health conditions like diabetes. The main thing in podiatry is diabetes. Yes.
Yeah, would you mind just sharing a little bit more about that sort of diabetic foot, please?
Of course. So as a diabetic, you become higher risk to skin problems and also infections, because if you're not controlled or a diabetic, then you start to lose sensation in your feet. If I'm not a diabetic, I'm a healthy individual. If I step on a needle, I would immediately feel it. But if you're diabetic and you have what we call loss of sensation or neuropathy, when you step onto that piece of pin or glass, you don't feel it. So I would take that piece of glass and pin out immediately. But for a diabetic person, they will leave it in there, not aware that it's there, and that actually becomes kind of infected and then leads to complications and things like that. So that's why, as a diabetic, it's so important for you to check your feet daily. If you can't bend and you can't see your feet, so you get a long mirror, and then you put your foot up, and then so that you can see the bottom of your foot. You look in between the toes, look at the nails, and if you have a wound, so obviously if you have a wound and you're not aware that there's pain, because one of the signs of infection is pain. Well, I have a wound, it's not painful, I'm not aware that there's a wound, then that can cause infection, and then if you don't take care of that infection, it can lead to gangrene, amputations, and things like that. Very, very complicated things that really the National Health Service podiatrists would be the best people to treat, because it needs fancy dressings, maybe a multidisciplinary team to control your diabetes, to get new shoes. So it's very, very, very complicated. The skin also dries. More when you're in as a diabetic. Circulation is poor, so circulation brings nutrients, okay, to the lower limb. But if you've got like a restricted blood flow to the lower limb, poor circulation, then things like wounds don't heal, nerves don't regenerate if they're damaged, and again that can lead to complications and things like that. So the evidence shows that you should walk. Walking helps with circulation, actually can create new blood vessels, tiny microscopic blood vessels that can obviously eventually maybe help with healing and things like that. But it depends on how poorly controlled you are and how much damage there is. So having diabetes is not a very nice thing. The main thing is really to control your diabetes. Look at your feet every single day, look in between the toes, look at the bottom of the foot. If there's any major issue, cuts, bruises, anything like that, and it's not healing, then see your local podiatrist. It's very, very important.
Okay, that's very useful. So we got some more questions coming in. We have one question here. Says, I have flat feet. What style shoes do you recommend to wear in the house?
So you have flat feet. What size shoes should you be wearing inside the house?
I know what style. Yeah.
I don't know your foot size. So
what style shoes?
What style shoes? Okay,
yes.
I was like, what size? I don't know what style. Okay, style shoes. Okay. What style shoes? So something with a little bit. Well, it depends. If you're used to having flat foot, then you just wear your flip flops, right? You're used to it. So there's no point of changing the shoe type, because if it's not causing any pain or anything like that, your foot, Olympic runners, they have flat feet, right? I'm not going to tell you, oh, but by the way, you shouldn't have flat feet. Your Olympic runner, change your foot type. So continue to wear flat shoes. If it's starting to hurt you, the arch, and you had an arch before and it's collapsed, then maybe shoes, I can't say the brand because there's so many brands, with a little bit of arch support might help, but you would ease in with the arch support. You don't go from no arch to like that, because your foot's not used to it. So I would say, I don't know, I'm not going to recommend any brands. If you have flat foot and you've always had flat foot, just continue with everything that you're doing. If you had collapsed foot and then all of a sudden you had flat foot, then recommend wearing any shoes with a little bit of arch support. And then if it's still kind of uncomfortable, let's say the arch, right, then go to a podiatrist to get an insert, and then you can put your footwear, put the orthotic into the shoes, and they can customize the corrected arch. So if you put I might be old school, but if you put your foot into neutral, which is, this is a subtalar joint, and then and what can happen is that you can have it mimics an arch, and then they mold it, and then that's your natural arch. But I can't recommend what style, because it depends if you're comfortable or not, to be honest.
Yeah. I mean, since I guess there's more people now working from home, we as a company have indeed actually launched a house shoe range, which is helpful for kind of this lady who asked a question, looking for footwear in the house. And so like I've mentioned before, we do have the option of adding the arch support needed based on your foot measurements, if that helps. Okay, so time flies. We got time for one more question. What's the best solution for dry and cracked heel?
Okay, so it depends on how cracked and how bad it is, to be honest. If it's like really thick and like it looks like you've gone to like the Sahara and it's like really cracked, then the best thing to do first is to go to a podiatrist. They need to file it down. They need to like scrape it back, and you can see that on my YouTube channel. And then you use a urea-based cream, and you apply it every single day, twice a day. Just slap it on there. And then after 2-3 weeks, those cracks, so by the time you see a podiatrist, those cracks should be quite fine, should seal and heal. Because once you have cracks, it's not the podiatrist's job to heal the cracks, because actually you can't heal the cracks because it's already quite kind of torn. Over time, as the cracks kind of becomes, so the cracks are like that, by the time you see a podiatrist, it's like thinner, let's say like that. Then you need to use the urea cream, and then it will mend gradually, and it takes a couple of weeks. So cream, urea-based cream, type in urea, and it should do the trick.
Okay, I hope that helped. So I'm going to share my screen of this contact details. If you do have any other questions that we haven't managed to come around to it, then I'm just going to put it up on the screen so that you can all see it. Here we go.
Hey, that's me. Oh, that's a very nice picture of you. I love that picture.
Thank you. I will put this as a full screen so you can see it better. Okay, thank you everyone for joining us today, and I hope this session has helped answer your questions. And like I said, if you still have more questions after this, then do feel free to get in touch. And so you have Marion's clinic website here, and her social media, and also on the right hand side you have our website and email if you need some help in terms of sorting out your footwear choice. Okay, so thank you very much again, and stay tuned. We do have some more exciting guest speakers joining us in the next few weeks, and so we will push out those information soon after this. Okay then, thank you guys, and take care. Have a good night.
Take care. Bye bye.